According to WHO, diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, or blood sugar, which over time causes serious damage to the heart, blood vessels, eyes, kidneys and nerves. Diabetes by type. Type 1 diabetes. This type is an autoimmune disease, meaning your body attacks itself. In this case, the insulin-producing cells in your pancreas are destroyed. People with type 1 diabetes need to take insulin every day. This is why it is also called insulin-dependent diabetes. Type 2 diabetes. With this type, your body doesn't make enough insulin or your cells don't respond normally to insulin. Your parents or grandparents might call it having a touch of sugar. Type of prediabetes. This type is the stage before type 2 diabetes. Your blood glucose level is higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Gestational type diabetes. This type develops in some women during their pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you are at a higher risk of developing type 2 diabetes later in life. Risk factors. Risk factors. Type 1 diabetes includes: have a family history, parent or sibling, of type 1 diabetes. Injury to the pancreas, such as due to infection. Presence of autoantibodies, antibodies that mistakenly attack your own body tissues or organs. Physical stress, such as surgery or illness. Exposure to diseases caused by viruses. Risk factors for prediabetes and type 2 diabetes include: family history, parent or sibling, with prediabetes or type 2 diabetes. Overweight. Have high blood pressure. Have low HDL cholesterol, good cholesterol, and high triglyceride levels. Become physically inactive. Being age 45 or older. Have gestational diabetes or have given birth to a baby weighing more than 9 pounds. Have polycystic ovary syndrome. Have a history of heart disease or stroke. Become a smoker. Risk factors for gestational diabetes include: family history, parents or siblings, with prediabetes or type 2 diabetes. Being overweight before becoming pregnant. Over 25 years old. Causes of type 1 diabetes. It is a disease of the immune system. Your body attacks and destroys the insulin-producing cells in your pancreas. Without insulin to allow glucose to enter your cells, glucose builds up in your bloodstream. Causes of type 2 diabetes and prediabetes. Your body's cells don't allow insulin to work properly to let glucose into its cells. Your body's cells become resistant to insulin. Your pancreas cannot make enough insulin to overcome this resistance. Too much glucose remaining in your bloodstream. Gestational diabetes. Hormones produced by the placenta during your pregnancy make your body's cells more resistant to insulin. Your pancreas cannot make enough insulin to overcome this resistance. Too much glucose remaining in your bloodstream. Symptoms of diabetes include: increased thirst, weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, wounds or wounds that are slow to heal, unplanned weight loss, frequent urination, frequent infections for no apparent reason, dry mouth. Thanks for watching.